Hi, everyone. We're just going to give people a couple more minutes to sign on, and then we will get started. Okay, aloha, everyone. Thank you for joining us for today's presentation. Today, Samantha Okubo, who hails from Illinois, will be presenting on how to prevent STDs in pregnancy. There is a lot of misinformation and fear around this topic, particularly with minors, regarding their confidentiality and their options and the availability of services. So Samantha is going to go through a lot of that in this presentation. Samantha has taken on multiple leadership roles during her time here at the College of Pharmacy, and her career goals include going on to do a special practice residency and traveling the world. So without further ado, I'm going to hand this over to Samantha, who will be talking about STDs in pregnancy. Oh, one more thing. If you have any questions during the presentation, please use the question and answer tab on the bottom of your screen, and I'll be monitoring the question and answer module and forwarding any questions to Samantha, which she'll answer either during the presentation or at the end of the presentation. Again, thank you.
Thank you, Dr. Gu, for that introduction. Hello, guys, and thank you for coming. My name, as Dr. Gu mentioned, is Samantha, and today I'm going to be presenting on protecting yourself from sexually transmitted infections and pregnancy by knowing your rights and options. These are the objectives we're going to be going over today. We are going to identify the prevalence of STIs and unwanted pregnancies, understand confidentiality rights for minors, recognize when to seek professional help, identify locations for low to no cost testing, describe common antibiotics used for STIs, understand how oral contraceptives work, and discuss strategies to find low-cost prescriptions. In 2018, in the United States, the prevalence of STIs was 1 in 5 people, totaling nearly 68 million people who had infections. There were 26 million new STIs recorded, and among the 26 million, almost half of the new STIs were among people the ages 15 to 24 years old, coming to about 45.5%. Since STIs are sexually transmitted, birth rates are affected. In 2017, there were a total of a little over 194,000 babies born in the 15 to 19-year-old range. That is about 19 pregnancies per 1,000 women in this age group. Now we're going to go into Hawaii-specific rates. In 2015, Hawaii ranked 14 out of the 50 states for both syphilis and chlamydia. In the graph on your left, notice an increasing trend since the early 2010s for syphilis. In the graph to your right, notice in 2015, there were close to 2,000 cases of chlamydia in women aged 15 to 24, which is consistent with national numbers, making this the highest risk age group. Now, in regard to pregnancies in Hawaii, girls aged 15 to 17 account for 25% of unwanted pregnancies, and girls 18 to 19 account for the remainder 75%. In Hawaii, we actually rank 19 out of the 50 states for our teen pregnancy rate. One of the main reasons minors are scared to ask for help or advice on what to do is due to their parents finding out. There are laws in place in Hawaii that protects minors' confidentiality. In Chapter 557, Section 2 is consent valid. In this section, it states that if a minor has an STI or is pregnant, that the doctors and other healthcare workers cannot call the minor's parents unless the minor wants them to. Now, let's say a minor does not meet those previous healthcare conditions. Will the minor's information still get out then? The answer is no. In the same chapter, but in Section 3, is providing information. This states that if a minor was not diagnosed with any of the previous conditions mentioned, that the information is still kept confidential. So the minor is 100% in control of who finds out about the visit or treatment. Now, how do you know if you have an STI? Well, here are some clinical presentations. Chlamydia may have painful urination. Syphilis may have sores, rashes, or swollen lymph nodes. However, the majority of the cases are asymptomatic, meaning these symptoms may not appear. Contracting an STI and not getting treated can lead to some serious complications such as blindness, infertility, brain damage, paralysis, and more. So it is important to know when to reach out for help. Having unprotected sex and wanting to avoid an unwanted pregnancy, it is important to seek medical advice. So one should get tested by their doctor regularly, which can happen at your annual physical, and most tests done is done by either a urine or blood sample. There are other places to get low cost or free testing, such as local health departments, Planned Parenthood, mobile clinics, and home testing kits. Locally, there are a number of places in Hilo that have STI and pregnancy tests. Also, if you are a student at the university, there is no cost to students. After getting tested, and if it comes back positive, here are some common antibiotics used to treat. First, we have azithromycin. Azithromycin works by inhibiting the production of vital proteins in the bacteria. This one is commonly used to treat in the management of chlamydia, but it's also used in common infections such as pneumonia. Next, we have doxycycline that works by inhibiting the protein synthesis of bacteria and prevents it from spreading. This one is commonly used for gonorrhea, but it's also used for skin infections and malaria. Lastly, we have penicillin G. This causes death by inhibiting bacterial cell wall. This is commonly used in the management of syphilis and other infections such as meningitis. Now, in regard to treating an unwanted pregnancy, this is how birth control works. The left side of the picture shows without using oral contraceptives, where the egg is released from the ovary, goes down the fallopian tube into the endometrium. And if the egg is not fertilized, it will exit through the cervix. Now, the right side of the picture shows how oral contraceptives work. Birth control works by stopping sperm from joining with an egg. The hormones in the pill safely stop ovulation. No ovulation means that there's no egg for the sperm to fertilize, so pregnancy cannot happen. The pill's hormones also thicken the mucus on the cervix. This thicker cervical mucus blocks sperm, so it cannot swim to an egg, working kind of like a sticky security guard. If one is not on birth control, there is another option of contraception. In Hawaii Law Title 24, Section 431, 10A to 116.6 defines contraceptive services as physician, advanced practice nurse, or pharmacist delivered medical services intended to promote the effective use of contraceptive services, devices, and supplies to prevent unwanted pregnancy. In Hawaii, there is no age requirement, and the price of Plan B ranges from $40 to $50. The hotline number provided is if a person is having trouble accessing emergency contraception. Plan B is available in pharmacies, And additionally, here in Hilo, one can find emergency contraception at Bay Clinics and Hamakua Health Center. Also, students at the university have access through the Student Medical Center. Plan B is not meant to be used daily and has no benefit in regards to preventing STIs. Luckily, using condoms every time you have sex really lowers your chances of getting or spreading STIs. Condoms also protect against pregnancy. So using both condoms and birth control together gives protections from STIs and unwanted pregnancies. Now we're going to switch gears a little bit as we go over a strategy to finding low-cost prescriptions. There is a website called goodrx. There is a screenshot on your left if you were to visit this website on your computer, or they also do have a mobile app that you can download. I'm going to go over how you can do this on your computer. So let's say one is prescribed azithromycin. You would go ahead and type that into the search bar. You would then click on the blue box saying find the lowest prices. It will bring you to this page. It gives you the name of the drug and also the certain kinds of infections that it helps to treat. And also it gives the average retail price. If you scroll down, it will give you pharmacies that are located near you, along with the estimate price that you will pay. I chose Safeway, so I will go ahead and drop down the Safeway and head over to get free discount. It'll bring you to this page. This is just a page that gives you the estimated retail price along with the estimated price you will be paying along with your estimated savings. But you need to hit the green get free discount. It'll bring you to this page. This is what you would print out or show to the person helping you at the pharmacy window, whether that be the pharmacist or the pharmacy technician. Now, this is just an estimate price, so the price is not 100% guaranteed, but it is better than paying full price. So as it has been shown, STIs and unwanted pregnancies can significantly alter the course of life. So it is important to know that treatments are affordable and that all information remains confidential. Thank you.
Thank you so much, Samantha. If there's any questions, please type them into the question and answer tab now, and we'll be happy to answer them. Okay, looks like there's no questions. Thank you, Dr. Kaneshiro. Did a great job, Samantha. So this video will be eventually posted on the College of Pharmacy website. And so you can always access it later at that time. Oh, I do see one question in the question and answer. One of the attendees would like you to go and elaborate a little bit more on how you can go about getting Plan B at a retail pharmacy.
So there are, you would just go up to the pharmacy window. It's over the counter, so you don't need a prescription for it here. And there is also a generic that usually costs a little bit cheaper, usually around $10 cheaper. So typically the name brand Plan B is $50 and the generic is typically around $40. And you can just walk straight up to the window and ask for it. Some places do have it also in the aisle as well. So you can also kind of find them near like where they keep the condoms and stuff too. But if it's not in the aisle, then it's definitely behind the pharmacy.
Yeah, thank you, Sam. To elaborate that on a little more, again, there's no age requirement for Plan B. So regardless of your age, you can go up to the pharmacy counter, ask the technician or pharmacist for emergency contraceptive or Plan B. Now, some pharmacies do reserve the right, like any business, to not offer certain services. If that's the case, it's important to recognize that that is not the policy of the company. So for example, if you go to one CVS and they don't have it or won't supply it, definitely go to another CVS or another pharmacy because you are entitled to that service regardless of your age. Okay. Well, again, thank you everybody for attending today's session. And we will be posting this online. How often can you take, another question that just came through, Samantha, how often can you take Plan B? Is it safe to take multiple times a year?
Multiple times a year, yes. But if it's more like in a couple day window, so say you have unprotected sex and you go and get Plan B and then take the Plan B, and then say you have unprotected sex the following day,